Welcome everyone. We'll get started in a second. This is terrific. I'm still seeing people join. We're over 100. I guess nobody's outside enjoying the sunshine today. Okay, we pretty much plateaued at 131 attendees. I want to thank everyone for joining us for one of two meetings where we're going to be addressing the plans for the university and therefore the College of Medicine in terms of reopening, specifically for the university the fall semester, but in the late summer, fall for the Larner College of Medicine. First of all, I just want to say hello. We miss seeing people in person. We will get to see each other again before long. Also, I hope people are staying well and continuing to practice social distancing or physical distancing, keeping masks when around other individuals, and staying home when you can per the governor's orders. So I hope people are well. Today we have the opportunity to hear from Gary Derr, who is Vice President for Operations and Public Safety. We also have three other panelists, Senior Associate Deans, Dean Brian Cote, Senior Associate Dean for Finance and Administration, Dean Christa Zehle, Senior Associate Dean for Medical Education, and Dean Gordon Jensen, Senior Associate Dean for Research. Now, Gary Derr was one of the first people I met when I was first talking with people about potentially taking this job. He's earned everyone's respect over his 20 years here at the University of Vermont. And he's really taken the point for the University of Vermont in terms of response to the COVID-19 pandemic, and likewise has taken the point on our reopening of the university, how to do that in a smart, safe, responsible way. So he's going to be giving a presentation in just a moment, and then we're going to open it up to the entire panel. I do want to mention that we have a Q&A feature, which we'll be answering live from the various speakers. So on Zoom, there's an opportunity to ask questions, and we'll get to every question that we can. So with that, I'd like to ask Gary Derr to speak to us regarding plans as we move forward in terms of the university and therefore the Larner College of Medicine. Gary?
Good. Well, thank you very much, Rick. And let me just start by just saying thank you to all of you. You've done an amazing job. You've been a wonderful resource to me and others. And, you know, I've had a couple of conversations and numerous emails with advice and information. And it has been unbelievably helpful as we try to sort out what is a rapidly changing and evolving situation. When I talk about our plans, they're kind of right now into three different sections. One is dealing with what we have right now, which is that we have a number of employees, faculty and staff on campus who are considered essential employees who are providing services that only they can do on campus. That's the group we're with right now. That's evolving. It's slightly moving up, as I know you're working on trying to bring back some of the research initiatives, efforts currently, and that's going to begin over the next couple of weeks, days and weeks as we go forward. Then there's the next phase of kind of the reopening of the university, which we don't really know when it's going to be, but that's as the governor lifts the restrictions in the state and we can begin to say, okay, you can come back to work. But there's a lot we're going to have to do, and I'm going to talk about that, and I'm going to try to cover the various questions that we've been working through on that we're going to have to put in place before that can occur. So it won't be, we're closed on Saturday or Friday and we're open the next Monday. There's a lot that we're going to have to do to put in place that. And then there's the third phase, which I'm going to do my best not to say fall, because I know fall is not the same language for you all. It's an earlier start for you, but the returning to more large scale in-person operation, whether that's the start of your students coming over the summer or in August when our undergraduates and graduate students begin. So as you know, in mid-April, President Garamella tasked a committee, the UVM Strong Fall 2020 committee. He asked me to chair it, a very small group of people with developing plans and recommendations around restarting the university for fall semester, and that we are going to do that. We're also charged with that, looking at other options and other scenarios out there, and we've looked at a variety of different ones out there. A lot have complications. I'm happy to talk about some of the ones that we've considered, but our efforts are directed towards returning to normal operations. And I say normal very loosely because it's not going to be the way it was September 2019 in September 2020. It's going to be vastly different, and it will be for a long time. So our group has been working with three very large overriding principles. First and foremost is the safety and well-being of all members of the university community, faculty, staff, students, and visitors to campus, because we have a lot of visitors to campus. As I looked at some of the strategies that are going on out there with businesses, it'd be wonderful if we had that one gate that everybody comes through in the morning and then they farm out all over campus, but we don't have that. We have 125 buildings on campus. We operate all across the state. You all know that as better than I do, but it's a challenging operation to have to deal with that. The second is that we need to preserve the quality of our academic experience. We did an amazing transition in March from in-person instruction, in-person lab work, in-person everything to remote. And we did that, we did it successfully in a very short period of time. But what we need to work on has to be that we preserve that high quality academic experience, which is critical for UVM. And the third is to provide a high quality student experience. And you know, I've seen some great stories, whether it's the UVM Symphony playing a remote symphony together, your match day experience, all those things that are those personal experiences our students have with our faculty, with our staff, with our other students, that got shifted into a new way at the end of March. We've got to make sure that the plans that we put in place assure that that experience is second to none. So then what our committee has been looking at is kind of at the broad macro level, and then we drilled down. So let me talk about some of the macro issues that we've been keeping in mind. So right now, there are not a lot of really big federal restrictions that are in place controlling our operations, but the biggest one right now is international travel restrictions. So that impacts our students, our international students' ability here to go to their home countries. It impacts their ability when they're in their home country to return back to the States. It impacts our faculty and our staff who are looking to do travel abroad and research abroad for either sabbatical leaves or leaves, whatever, presenting at conferences. That's significantly restricted right now. Not for your case, but for our students who are looking to do study abroad, our summer study abroad program was canceled. We're looking at the potential of what might be in place for fall, and in spring, whether those study abroad options are going to be there. There are a lot of in-country travel restrictions that are still in place. We've talked a little bit, and you may be familiar with right now, if you come to Vermont and you're going to be there for any period of time, you need to quarantine for what just changed last Friday to 12 days from 14 days. And now they've added in a nice little benefit, which if you're here and you're 7 days asymptomatic, you can request tests. And if that test comes back negative, you no longer need to quarantine for the balance of that 12 days. But with that, there's also in other states that have travel restrictions that impact our students and their families' ability to move around. So as we think about family coming from New Jersey and they might be moving their son or daughter up to UVM for an experience, what's the impact on them when they return back? So it's kind of a big web that we're trying to track and manage and keep track on. The other thing we're monitoring, and I said to Dean Page when I would do this, that this one probably gives me a little more anxiety because now I'm speaking to about 160 medical professionals, and I'm not one of those, that, you know, we're tracking the progression on vaccines, antivirals, and antibody research that are really a critical thing to come forward. I don't need to tell you that's moving. We wish it could move quickly. Obviously, we need to follow that. The other thing that we're tracking is CDC guidelines. In March, the CDC issued very specific guidelines for higher education institutions. They've not yet issued anything more. I know your association has issued guidelines, Annie, I think it is, has issued those guidelines about it. I expect that probably in the coming weeks and months that the CDC will issue some new guidelines out there for institutions of higher education. Whether they'll do that so it aligns with opening of summer school, or whether they'll wait till the middle of summer so it ties with any type of more traditional August opening of schools. So then we move from there down to the Vermont level. And those of you who track the governor, he issued his stay home, stay safe executive order. And then what he typically does is he issues addendums that either elaborate or explain something that was initially put in place, or new guidelines that fall into place that Vermonters then have to follow, businesses have to follow. We track those pretty closely. They typically come out on Friday. He surprises us with some now and then midweek, but then we've got a team that then takes a look at those and determines how do we implement those addendums at UVM. And I would say probably the most significant one was Addendum 11, which came out about 2 weeks ago, which put into place required COVID-19 training for all employees working on site. We very quickly put together, using the guidelines that they gave from VOSHA, we worked with our folks on campus to develop a training. I know some of you, probably even on this meeting, did that training. It is very likely that we are going to move towards where next week, where we're going to be ready to launch because as the guidelines have been on issue 12 and 13 right now, those guidelines continue to say for employees working on site, they must go through this training. So we're going to do that. And I think it's also good practice. It was a little bit cumbersome what we did, and I appreciate your understanding of it, that the employee had to print out their certificate of completion and then email to their supervisor. I know there's some confusion with supervisor PI, but we got it done. We're going to look at a much more efficient way, but we had to do this very quickly and very swiftly in there. And I see somebody say I'm breaking up, so I'll try to, maybe I have some things over here I can shut off. So learning to work remotely here. So give me 1 second here. Rural bandwidth has some challenges here. So, so we had to put that in place. We also had to put in a requirement that we had a university health safety officer. Some of you know Francis Churchill. We designated that, but what that person's role is, and this Addendum 11 was really directed towards like fixed sites, like construction sites, where I show up and there's a site supervisor, a construction supervisor, and that person asked me a series of questions about whether I have symptoms or not. That's realistic when you've got one site, but when you have 125 buildings, that's not realistically. So we're realistic. So we're looking at some options through remote reporting. So people logging in and filling in that information and reporting coming into supervisors, obviously needing to protect privacy issues, other issues associated with that. But right now we got to find a way to do that when we ramp back up and have 4,500 employees that we're working with. I've talked a little bit about the quarantine piece. That's going to be something we're going to have to deal with. That is in place right now, as I said, 12-day. That's something that's changing. I think, let me go off my earbuds live, and maybe that will help with some of the noise. Sorry. Learning how to do these things. So, we're going to have a strategy in place to deal with that quarantine issue when we come back. The other issues we're tracking socially extensively has to do with hotels and ability for those to open, restaurants as well too. Right now, our dining facility is, and our retail dining are considered that, so we have to find out and wait for that to opening. The other thing that I think is going to be very critical as far as a broader opening is the group gathering size right now is limited to 10. That's difficult to see how we work on that. There's social distancing, physical distancing requirements that are in place right now that we're going to have to manage. Right now, it also, the Vermont Department of Health indicates that all employees have to wear face coverings. So we're figuring out how we manage to do that. I've been working with Gordon on that and faculty there. And the other thing I would say that's pretty big is the daycare and schools. And that affects a lot of employees at UVM and how we manage that. The other thing, both at the national level and at the Vermont level, is the supply chain. And that's both supply chain for supplies for COVID-19, PPEs and things like that, but it's also the general university supplies that we need to manage and rely on in order for us to operate. They're backed up, they're delayed getting their shipments in. Some of those essential businesses are closed. We got to wait till they open up so that we can get those supplies, business and office supplies and things like that. And then we talked about some of the more regional issues. Then there's some real, very specific UVM issues that we're going to have to get through, not as much that affect you all, but that affect the undergraduate population. And that has to do with our residence halls. So in we told our resident students we were going to shift instruction. We told students to come up, get your belongings that you need for a couple days and go home. What's ended up happening, and I think we all hope that that would be a brief period, 2 weeks, 3 weeks, whatever, that we'd be able to return to some normal operations and that students would be able to come back and get their belongings. That has not occurred. So what's happened is our residence halls right now are large storage facilities that have belongings in there that we are developing a plan for them to move out. But until there's a lot of changes on some statewide, we can't let them back in to get that. We're looking at maybe Vermonters coming first in a very staggered, organized way, so they're not dealing with the travel restrictions. But in order for us to, we need to get everybody out, or to clean the halls, do some physical work in the halls, and then reopen in the summer. I know that's dealing in some issues. I know you're dealing with housing off campus. I know you're able to find some places, but those are issues that for us on campus, we're having to deal with. The other thing is, you all know, we made arrangements for the University of Vermont Medical Center to use Patrick Gym as a surge site, and as well the multipurpose center. They still have use of that facility. That has a huge impact on athletics and our ability to stand that up. There's parking that's available. They've not needed it, thank goodness. I don't know when we're going to be able to get that back, hopefully soon. The other thing that we have to work on, and we've got teams of people working on, is identifying a quarantine and isolation space for our residential students. I'm looking at space off campus for, most everybody says, oh sure, I'll rent you a bunch of rooms, but not for people that are positive. So what we're looking at having to do is to move our current students off campus to a site and then relieve some space on campus that we could turn a facility into a site for quarantining students that test positive or that need to be isolated if they do test positive. So then we're looking at a whole range of mitigation strategies. And what we've seen in information that's been shared, research that we've given, a number of your faculty have met with our committee to offer some information, that there are really 3 key strategies that we need to have in place in order to expand our operations and return to in-person operations. And those are testing, contact tracing, and isolation and quarantine, which I've talked a little bit about. A lot's going on about testing. You know, it's relaxed a little bit, but if you think about 16,000 faculty, staff, and students that we would need to test on any regular basis, the state of Vermont has only done about 21,000 tests across the entire state right now. So if we think about any type of regular or systematic timing of testing of our population, the capacity is not there yet. It's starting to improve, and hopefully we'll be able to do more testing, But right now, that's still really restricted. And how you get that is still through your primary care physician. But we're going to have a means by which, if we're looking at testing larger groups of any, whether it's faculty, staff, or students, the availability of this. There's been some really encouraging work. Again, I don't need to tell you all about point of care testing, so that if a student goes into our Center for Health and Wellbeing, gives a saliva sample, do the test right there, takes about an hour to get the results, sometimes even less. Right now, if the current testing is 24 to 48 hours and sometimes longer because of the chain of which we have to go through to take the sample, send it to a site, maybe offsite, get it back and get that information back. So that the whole means of testing has to be improved, and it's been improved. What we had 2 months ago to where we're at right now, dramatically different. And where we're going to be at a month from now, again, I'm confident is going to improve. So we're going to have to figure out what that protocol is going to be on campus. We're looking at setting up some remote sites on campus. So if we limit our Center for Health and Wellbeing just to, I don't want to say well care, but routine healthcare issues, what might be some locations on campus, including a trailer, where we would do COVID testing in that site so that we can relieve the strain on the other facilities, but also maybe have some mobile units. I guess that when one of the nursing centers, they actually moved an RV there and ran it through an RV. So that might be something we might look at having on campus. I understand that, cleaning and sanitizing and the privacy issues there are all issues that we're going to have to address with that. The second is contact tracing, and there's been a lot of work done on that. Right now, the Vermont Department of Health indicates that they've got staffing levels enough to be able to do contact tracing. There was a point in the middle of April where they didn't, and what happened is our folks took on the contact tracing. That was possible because at that point, our employee base on campus was much smaller. We had no students other than about 115 residential students. Off-campus population dropped as well too. We were able to step in and do that. One of the things we might consider doing is setting up our own contact tracers on campus that we would supplement through training and education to be able to deliver that task for our population, thereby relieving the burden on the Vermont Department of Health, because as we open up across the state, it's reasonable to assume they're going to have to do a lot more contact tracing. I've read a lot about the apps, and there's some really encouraging potential for that, where you download an app, you use Bluetooth. I carry my smartphone everywhere I go. It records my contacts, and then if I test and then test positive, I give my phone. They pull the data off that, give it to contact tracers, and it just tells people who I've come in contact with over that period of time, which will expedite our ability to reach out to those people and say, you might need to get tested, you might need to. But right now it is, Gary, who have you been with? What meetings you've been in? Who you've been with? And if you think about a typical medical student, how many people they come in contact during a 6-hour day on campus, it's significant. So finding a way to more efficiently manage that. And the third thing that we're looking at has to do with the what we're referring to as supportive quarantine and isolation. So when we had to very swiftly set up space to quarantine students, we identified rooms, we outfitted them with, food service could come in, custodial services, healthcare services were there. But what we want to think about is how can we make that environment for our students, whatever level they're at, supportive enough that they can stay actively engaged in their academic experience. Ways that they can connect with faculty. Can they join remotely if they have to be quarantined for whatever that period, and that's been moving back and forth. How can we make sure that they continue their academic experience so that they're successful? Similarly, and I think we had a great deal of success over the last couple of weeks with transitioning to remote operation for faculty and staff. But if a faculty member or a staff member has to quarantine, how can they stay engaged? How can they continue to deliver their coursework remotely? Same with an employee. We're doing that all right now, but how can we transition to that and keep that person engaged as long as possible? Obviously, if medically they can't and they need to take care of themselves, understood. So that's kind of the three broad strategies we're thinking about. So then we get into some real logistical type issues, and I've got a team that's working on them. Right now with the physical distancing requirement, that presents a lot of challenges. So we're looking at how do we manage those large sections. Carpenter Auditorium, I'm pretty sure that's the name of it. So we don't have, good or bad, we don't have a lot of those spaces on campus that we have to deal with. So when we look at those classes that are 200 or above, there's just not a lot of them because there's not that many. How can we move those to a different form of delivery so that we can then take the next tier down, move those up, and then continue to work up so that those smaller classes that we have that are in spaces that we just can't manage to reduce the size so that it's effective for use of any sorts. There's going to be a lot of creative. We may need to move some of our courses completely online to free up spaces. So I'm going to be working with UVM Campus Planning and Facility Design to do an analysis of all of our spaces on campus to say, if we have to have 6-foot distancing in there, what's that going to look like? In those spaces that have fixed seating in, how might we put tape on those? I mean, unless somebody comes with a better idea, don't sit here tape, so that we can space people out in those rooms. We've talked about, now there's a storage issue, pulling chairs out of some classrooms. So if we say what was a 40-person can now only be a 15-person, how do we prevent that from becoming a 20-person just because there's seats in there? Actually pulling furniture out of those spaces. So we're gonna have to do a whole analysis very quickly of our class space. Could we use our Allen, which seats 900 and is much larger, and we could spread out? But then going back to something I mentioned earlier is that the current state requirement says during a shift, you have to clean before a shift, during a shift, at the end of a shift. That again works really nicely when you have a shift that's clearly defined between 8 to 5. But universities don't operate in that. So is a shift class to the next class? Is it morning to afternoon? What's that going to be? So we're going to have our custodial staff deployed to do a lot more cleaning of high concentration area, high touch areas. We're also employees to clean their workspaces so that we can focus our custodial service staff on other areas. The other thing that we're going to have to look at is, I had a note pop up here, I'm sorry, I lost it. How we manage workspaces. So there are workspaces that are just going to be really problematic with the 6-foot distancing. And we're going to be coming up with guidelines university-wide, but then we're going to be drilling those guidelines down to you all saying, you got to come up with those solutions there. One option you might consider is, you know, I've got a staff member who works in 3 people in a very tight office. I can't enlarge that office. What I may need to say is 2 of you can work Monday, Wednesday, Friday. The other person works remote Monday, Wednesday, Friday, and then Tuesday, Thursday, we switch that out. We might need to look at some of those smaller spaces that all the amount of reconfiguring can only be 2 people in a room because it's just small. I have a couple of those that I manage through the president's office and through other offices that I manage. We may just say they're offline for conference and meeting space. Therefore, we don't need to have them cleaned. But more importantly, we might be able to use those as spaces for staff. We might need to reassign those spaces for employees to work out of there for other purposes. So and then the other thing that we're having to do right now is, and we're going across campus, is installing plexiglass screens in high profile contact areas. So reception desks, entrances to buildings where people are greeted there, in the residence halls, opening spaces there. So we're looking at having to put those all in place. I don't know whether we've gotten into the Larner College of Medicine space yet or not, but I know we've done a lot elsewhere on campus and ramping up for that. So that's really a kind of a broad brush. I mean, we're also, you know, how do we deal with employees that are faculty or staff that may have underlying health issues that prevent them from being on campus? How do we accommodate their needs? Similarly, how do we accommodate students who, for their same health reasons, can't be on campus? Can we stand up enough courses that they can continue remotely and continue their progress, but not be on campus during that period of time? I'm dealing with issues of health issues and face coverings, that they just can't wear those face coverings, and how we might do that. Let me talk about face coverings and other PPEs. We're wrestling right now of how we provide PPEs, face coverings in particular, for employees. I think probably what we're going to move towards is where we're going to issue a supply of cloth face coverings to all employees. And they're going to be expected to maintain, wash them, and use them. We're encouraging groups to say, you give away the cute little mugs or the bandanas or whatever in the fall. think about giving a Larner College of Medicine face covering as a promotional thing so that we can make that kind of a new norm on campus. Because right now, all employees working on campus when they're in public settings have to wear face masks. I think that's probably going to continue into fall. It's something we're going to probably be expecting more students to do. So I've gone probably longer than I should, but I want to, kind of pause there. And if I can answer any questions, and I know other people can help field them and redirect them as well too.
Great. Thank you so much, Gary. And why don't we go back to gallery view, if that can be done, Bruce, in terms of so people can see the panel we have here, our distinguished senior associate deans. Before we kick off, that's the first I've heard about the idea of issuing cloth coverings. I think that's a great idea. Just everybody stapling this together or getting that, to just have kind of a standard and an expectation of everybody, I think would be a great direction if you all decide to go there with the UVM Strong committee. Before we take questions, is there any specific comment or clarification, Dean Zehle, Dean Cote, or Dean Jensen, that you want to share? All right. Hearing none, let's look at a couple of the questions, and those of you who are listening, 162 of you, Gary, you never knew how popular you were. If you can just use a Q&A and type in a question. The first one being, please address teaching for courses with very large enrollment for fall 2020. In these instances, physical distancing can't be achieved. Will UVM have a hybrid approach to course offering, some in person and some remote teaching? You addressed that somewhat already, Gary. Any further clarification?
Sure. I mean, I think that, again, I mentioned earlier, we're benefiting from a lot of information, and we're looking at outfitting classrooms on campus so that, so I'll run through a variety. Could the lecture be recorded, then posted online, and then the person observe it? Could you take a class of 50 students and say, on Tuesday, 25 will be in class, the other 25 will be viewing it live and be able to chat back and forth with the professor. And then Thursday, you flip that group. Where, I don't know whether I mentioned it, but the Honors College has a model for their large lecture class where Monday, Wednesday, they meet in smaller groups. So we might be able to accommodate that smaller group model. But then on Friday, they have a very large plenary lecture where they invite all the students to, I don't know where it is, Billings Lecture Hall, one of the large venues. That may have to be, going forward, a large venue of a team session in there. So I would say that to answer that question, yes, the Center for Teaching and Learning, I'm sure that you're providing support for faculty members to develop various things there. So it is one of those things that will provide direction, will provide training, but it's going to come down to dean's offices, department chairs, faculty saying, here's how I'm going to need to deliver my course in this setting. I've had some conversations about the sim lab and how we might need to manage and accommodate that. I mean, that's a little bit difficult, but we might need to figure out a way to get around that and work with that.
Great. And I'm going to take the chair's prerogative to ask Dean Zehle. Christa, do you mind commenting? Gary mentioned the sim lab issues that may be resolved or unresolved in terms of the sim lab, and we need you to unmute, please.
Yeah, absolutely. So certainly we have some educational experiences or activities that make physical distancing more challenging. The simulation lab would be one of those where students are engaging with standardized patients and would be in much closer proximity. So the Director of Medical Education, Dr. Kate Nicholas, has already established a proposed protocol that's being reviewed at the university level, which just has some additional requirements from what might be required for education where you can physically distance. And we'll want to ensure that we just have consistent guidelines from the university to be able to share with our students. So that is being looked at as well. I'll just make a comment about our educational activities and needing to physical distance in our preclinical curriculum, and that is being looked at by our curriculum team as well, with some of the similar ideas being considered, as Gary Derr mentioned, with whether you alternate when students come in, alternate maybe first and second year class, do a lot of small group, which we do anyway for active learning, which is great. So just considering all those different options as we prepare to return.
Thank you. Next question. I've heard from someone who sent me an email just now. They're having trouble getting onto the Q&A. On the other hand, we have 9 questions already, so at least many people are not limited. Question, Gary, and maybe Gordon as well. Are you investigating whether ventilation is adequate, for example, in given offices?
So I'll speak broadly. The folks in risk management, environmental health and safety, one of the things we have to manage and address is air handling. So at some point we'll be going around all over campus to see whether it's adequate handling, air handling, or whether we need to create not 6 foot in there, but a larger space in there. So I don't know specifically to the dean's offices, but I would say across campus, that's something we're looking at.
Great. Anything to add, Dean Jensen?
No, I really don't have anything to add, other than I know that Eric Gagnon is tuned into that concern as well as other environmental issues that we'll be facing.
Great, thanks. Gary, in addition to face masks, will UVM coordinate the acquisition and distribution of disinfectant supplies?
Yeah, so one of the things we're thinking about doing, and we haven't been able to find the container wipes, whatever brand you want to refer to wipe down the desk. What we've been able to find is we've got plastic spray bottles that we're likely going to fill with disinfectant. We're able to get the cloths, and then we would distribute that disinfectant to employees to clean their own space and to wipe it down, and then collect those cloths, launder those, and return them. So still kind of working through that, but I'd love to get the jar of disinfectant wipes. You just pull out your wipe and just clean it down. Just can't find it. We're looking at expanding the hand sanitizer stations across campus, particularly at probably entry areas more. And I'm probably less of a concern. I think you probably have it much handle over there. We've made the transition to all of our hand sanitizers on campus being alcohol-based now. So I think we're in good shape with that, but we're doing an assessment about where we need to improve that.
Great, and thank you for that changeover in to alcohol-based hand cleaner, which was not what we had in our in the Given building anyway before all this came about.
No, there was probably some good reason. I understand it has something to do with storing all that alcohol-based chemicals somewhere and safety, but good idea, not academic.
Question, I'm wondering about any role for serology blood tests for antibodies to see if they could be incorporated into the re-entry planning.
So I think yes. I think, and thank you, Dr. Morova. I would say yes. I think that there's a good role for that. I've had some good conversations with some of your colleagues about that. I think we'd have to think about what's the best use of that. And yeah, I think there is. And I certainly would look for you all to tell me, here's a good role for that.
Fair enough. You mentioned understanding the concerns around parent employees as UVM considered how it will address likely rolling closures of K through 12 schools or independent school closures from bankruptcy and its impact on parent employees.
I hadn't thought about it from that perspective, but I know that one of the conversations we've had related to some vendors is some of our vendors may not be operating anymore, smaller ones in that. So we have a team of HR folks that are developing HR policies and how to manage those situations around daycare and public schools that are closed and what type of support we might provide there. I know Carmen works very closely with the university's HR office and those policies. So I think that's one we're going to have to keep in mind and keep an eye on. If schools, I would imagine that just primarily be private schools that would be affected and have to close.
Fair enough. I'm going to take you off the hook for a second and put Brian in the spotlight here. Brian, there's a question specifically for you. The Disbursement Center has told us that PER cards expiring 5/31/20 will not be renewed at this time. Is that correct? And if so, this may disrupt business processes for those who pay UVM bills online. Would it be possible to rethink this if indeed that's the case?
Well, thanks for the question. Um, I have a phone call with Erin Fitzgerald tomorrow, who's the leader of disbursement, to help think through these strategies. Anyone that's been listed as essential personnel will get their perk card. For those folks that haven't been listed as essential, they will be distributed at a later date. But I'm meeting with Erin tomorrow via Zoom to talk through strategies for how to get people their perk cards before they expire. More to come.
Fair enough. Thank you. Gordon, I'm going to push this over to you. Distancing is key, but how will that be achieved in a lab class? The number of lab with equipment to train students is limited, and often this kind of class involves 3 to 4 hours per day in the lab.
Yeah, so this is another one of the major challenges we'll be facing going forward. And of course, the immediate solution would have to be staggered scheduling to the degree possible so that we could rotate appropriately sized trainee groups in and out of training laboratories, especially true for hands-on experiences. Alternatively, those that don't require as much hands-on experience, there would be the potential for remote experiences. But the truth of the matter is it's a great challenge, and we'll have to figure out how to distance people appropriately and move them through in a staggered fashion for some of these.
Great, thanks very much. I'll pick this one up, and that is, will buildings remain locked? I'd point out the buildings are locked only to people who don't have keys. And from my standpoint, I would see that going on for the indefinite future. For example, we have criteria to be allowed to come back to campus. We can't have people who just walk in off the street coming into university buildings, certainly not into Larner buildings. So for that reason, I would emphasize these doors, at least the Larner doors, are open to those who had keys in the first place. We didn't make them just essential to get in. We do keep track of who's in there, and if you're not essential, you may get a call. But the fact of the matter is, early on, before the campus closed, we decided we shouldn't have extra traffic, for example, coming through Gibbon to get to the hospital, because it might be convenient. We only need to have people in there who are trained in any effort to reduce contagion from this pandemic. Gary, is that consistent with your perspective?
Absolutely consistent, and I would add in just a different element of it. It's a safety risk. I mean, if you think of some of our buildings, that you could be the only person on the 5th floor of Old Mill, and just the safety factor in there of limiting the access to the building. So, CAT cards, your ID cards that open up doors, they were not changed. We thought about that at one point to control it, but we figured it just was not worth the frustration that would cause of people not being able to get in the building if for some reason they did. But I absolutely agree with what you said.
Great, thank you. Gary, what's the timeline? Oh, actually, Gordon, what's the timeline for resumption of NIH-funded human research that isn't COVID or essential?
So we have an active working group that I'm chairing that Claude Deschamps gave us a charge to pursue these questions. Met for the first time last week, is meeting again next week. We're just beginning to roll out the processes for opening up human research that's non-COVID. And you may anticipate, certainly in the next 2 weeks, hearing more. We're hoping to quickly get out some clear guidance on what is allowed at the present time, and that is specifically hospital or clinic research that is part of routine standard of care, does not entail incremental risk, and does not put research personnel at risk. So guidance about that will be coming out very quickly, but will be following up with specific guidance about the CRC, the Clinical Research Center, about community-based research as well. So stay tuned, but we are definitely working on that one.
Great, thank you. Gary, there's a comment that the plexiglass is a great idea for front reception areas. Is that being considered for cubicles as well?
So I would say that may be challenging, because remember, it is the 6-foot physical distancing that has to play in there too, whether it can be modified to say, okay, the cubicle is going to have the plexiglass and you're going to be 3 feet apart. I don't know about that. I'd have to talk to my environmental safety. It certainly does not, based on what I read in the governor's directives and the general health recommendation, that is a viable option.
Great, thank you. Dr. Isabelle Desjardins has joined us. Gary, if you don't know Isabelle, she is Chief Medical Officer for UVM Medical Center. Welcome. She asks, have you thought of joining forces with the supply chain team at UVM Medical Center?
Yeah, that's a good idea. I mean, something we can certainly look at. I had not thought about that. I know we've got a lot of strong connections there, but I think you're right. That's a good idea.
And likewise, she suggests that there might be opportunities to learn from the hospital in terms of screening, testing, and space process engineering.
I couldn't agree more. I heard about how they manage, and I may not get the name of it right. I can pull it up. The UVMMC Employee Healthcare Center. I may not have the right name, but that's a really intriguing model because, and the person who was explaining it to me was, you know, the person can go in with an issue, get the test, it comes back, it goes to an HR person, not to a medical person, which again, if what I'm trying to think is how do we shorten the time from when we test, get results to responding to it, and then the person's referred out to their primary care health for treatment.
Fair enough. Gordon, this probably goes your direction. Can you make a special dispensation for the Colchester Research Facility since the density of workers per floor area is lower than in the Given building or elsewhere on main campus?
Well, there wouldn't be a special dispensation. The basic requirements would still be the same. It just will be much easier to meet them there. And of course, we already have approved essential research personnel at the Colchester facility. Let me just say that within the next 24 hours, very detailed guidance will be coming out from us electronically about a cautious phase reopening of our laboratories that is follow-up to the guidance we released a week ago. And of course, we're targeting September 8th, I say September, make that May 18th as the first phase of cautious reopening of laboratories that will at this point involve essential personnel, and over the subsequent weeks in careful phases, we'll be adding additional personnel to that rollout. So stay tuned, but there'll be a lot of additional information coming out very quickly. And certainly our colleagues at the Colchester facility will be engaged in that as well.
Great, thank you. When I first arrived about 1.5 years ago, the one thing that was off limits for my town hall meetings was parking. I'm not in the hot seat this time, Gary. So 2 questions about parking. One is, when will the Given parking lot be returned to UVM use? And another, more pointed perhaps, for those of us parking in the Given lot and returning back to work, will hospital staff still have our spots that we are currently paying for, which is something I hadn't thought of. So do we have an estimate of the changeover? Because for one thing, I think it's wonderful that the university stepped forward. Those spots were empty, and riding public transportation just was an added risk for care providers who were already stressed to the max. So that was the right thing to do. As things are changing, can we keep in mind the medical center staff and whatever risk there might be, hopefully lower now, but also getting back to business, we've got to be able to park our cars.
Yep, I agree 100%. There's not a time frame, but there's a plan that we need to have. You know, one of the things that when we say we're going to reopen or we're allowed to reopen, it's not going to be that, you know, again, that 24-hour turnaround time. It'll be a slow, gradual reopen. We have a little bit of an advantage right now with the timing. And I, you know, a colleague years ago said to me, the one thing you don't ever want to have to manage on campus is parking. And I've avoided that all my career right now, and I hope to continue to doing that. But right now, like the lots around Given, Jeffords Hall and stuff like that, and I've not been to campus in a while, so I don't know it, but like Jeffords lot is not going to be needed this summer because the faculty and folks that would have used that space because of its connection in with like Jeffords Hall or with Aiken or data center, that's not going to operate. They're not going to return back there. So there may be not a UVMMC faculty, staff are parking there one day and not the next, but it may be a gradual shifting of that. But that's one of those issues, not unlike the Patrick Gym. We're going to have to get that back in order for us to operate. Another one that I'm pretty sure has been resolved right now was the emergency ER setup that they set up outside of Converse Hall. We were really concerned if that was still operating when we reopened with students, how comfortable our students and their parents might feel as they looked out their windows, and right below there was this tented facility for the remote ED space there. So those are all those type of things as we transition back and forth that we're going to have to work through so that space is there. But I mean, and think about how the UVMMC medical folks are going to have to get back and forth from the remote parking spots.
Great. For those listening, 153 of you, we just got a comment again about parking. As Gary, fix this. As it stands, UVM faculty are only able to park at the very farthest corner of the Jeffords lot. It gets worse each day with very few slots left. Sooner than later, help will be needed. So we need to be finding a balance for.
Yeah.
Okay. Maybe I should interject, Rick. I know that Eric Gagnon is already working on this at my request, and we've been in touch with folks at the medical center and university parking, and especially since we are beginning our reopening and our faculty and staff looking for parking will be rising over the next 4 to 6 weeks. They are aware of the problem, and I believe that they will come up with a solution for us, but stay tuned.
Good.
And I think a good point is there are people who have paid for those parking spots and they haven't been using them. They haven't been needing them perhaps, but they will again. But at the same time, we need to accommodate our healthcare providers, UVM Medical Center, one way or the other. So right now, we have no active questions. I want to call on Brian and then Christa and then Gordon as to any further comments that you might have. Dean Cote.
I guess what I'd say is that, we've got a lot of things that are moving rather fast for us, but we're really spending a lot of time thinking through carefully planning for the real FY21 and 22 budget, and we're making good progress there. There'll be more to come out as the summer months start in. And then also there are just been a number of HR questions coming through, and Carmen and I are trying our best to answer the questions as best we can with the information we have at the moment. And that's sort of where we're at.
Okay, fair enough. Thank you. Dean Zehle?
Yes, thank you. So daily, I would agree, there's updates coming from national colleagues and local, state guidance and university guidance. One of the things that we're really working on is to try and bring our students back to their clinical activities. And so we're planning for June for our senior medical students and July for our more junior clinical medical students. And that takes a lot of coordination and planning and working closely with our university partners as well as our medical center partners. So that's kind of where we're at.
Thank you. Gordon?
Yeah, I would just reiterate, as I said, that very detailed guidance will be coming out in the next 24 hours regarding a cautious phased laboratory reopening. And on its heels will come the clinical research opening, which will also be scaled in a safe and appropriate manner. So we'll have more information for you. I know everyone's very anxious to move ahead quickly, but it's also true we have to be cautious and safe. And thank you for your attention.
Thank you very much. This is a little bit off topic, but I'm going to go ahead and take it. First of all, there was an expression of gratitude for the generosity of the team assembled here in terms of from the Larner College of Medicine in terms of the executive team and compensation, and a question about the 5% payroll reduction that we're looking for. I should emphasize the payroll reduction is from general fund. That's not from grants or from other mechanisms. We put a dent in it just by the senior leadership, voluntary cuts of a month compensation. But we're going to be looking at every unit, especially looking for unfilled positions to manage our costs. This is very serious. If you saw my note on Friday, if you saw President Garamella's letter today, this is really serious, folks. So what we need is not to panic, but to take this seriously, to come up with ideas of how we can reduce costs, how we can be more efficient, and we can get through this. So I don't have any other specifics about that, but I did want to address that comment. In closing, I want to thank the people who are on with us. We've only lost a few at 146 right now. I'm amazed at how, despite the fact none of us can be in the same room, we get more people together for events than I've ever seen as your dean. For example, we've been close to 300 people at 2 different town halls, and I wouldn't be surprised at our next one if we were at that number or higher. A crisis brings out the best in people quite often, and that's what I've seen. So as you've been hearing, you've got a lot of smart people working on problems. We're learning from each other. I love the idea of better connection with the medical center and learning from each other. Dean Zehle mentioned, and likewise Dean Jensen and Dean Cote are involved in national organizations where we will gladly steal from other people's good ideas, and likewise they can steal from us. So we will get through this. We just need to work together. I really appreciate people coming together this evening. And with that, I'll give you 3 minutes back at the end of your evening. I just want to wish everybody a good evening, and thanks for all you do. Have a good night.